Hi, welcome to J Sweat Plastic Surgery. I'm Dr. Jeffrey Sweat. You're being asked to watch this video today as a general introduction to the practice. It is our goal here that you are taken care of in a state-of-the-art facility, but also that we make sure that you're comfortable and that all of your questions are answered. This is definitely a team approach. As an individual surgeon who operates anywhere from 3 to 4 days a week, I rely on my team around me to help with your care throughout the entire process. I've also surrounded myself by people who are highly educated about what we do, so oftentimes they will answer your questions. If you have any questions that they can't answer, obviously they'll talk to me and we'll make sure that we have all of your questions answered. But it is important to understand that it is a team approach, and oftentimes throughout the surgical process you will interface with me from time to time, but you will often interface with my staff more frequently than you do with me. And this is so that we make ourselves available to you at all times and any time that you have problems. Obviously, we will provide you with an emergency number that you can call after hours, but when our office is open, it is always best to call the office to get the fastest response. If you have any questions or concerns about the process and how we are taking care of you as a patient here at J Sweat Plastic Surgery, please don't hesitate to ask. Thank you and welcome to the practice. The purpose of this video is to provide some basic education regarding the techniques that are associated with breast reduction or breast lift surgery. The reason you're being asked to watch this video is because either you've chosen to proceed with a breast reduction surgery or you're having a breast lift surgery with or without an implant. It is important to understand that if you're having an implant associated with the lift surgery, it does increase the complexity of the operation and does increase the risk of revision surgery later on down the road. The implant is generally placed through the incision that we use for the breast lift surgery. The breast lift is designed to remove excess skin and also reposition the nipples into a higher position. There are 3 basic techniques to a breast lift type surgery. And when I refer to a breast lift, it's important to understand that I'm also talking about a reduction. The 2 surgeries are done in a very similar manner through the same incisions. A breast reduction surgery will remove some breast tissue to make the breast smaller. A breast lift surgery simply reshapes the breast so that it has a much more aesthetically pleasing position. If there is some asymmetry in the size of the breasts when we're choosing to do an augmentation with a lift, I oftentimes will take some tissue off of the larger breast so that the implants are the same size, so that years down the road, if you have to have more surgery on your breasts, you will simply remember that your implants were the same size, even if you remember that your breasts previously were not the same size. The 3 basic incision techniques are an incision around the nipple, also known as a periareolar or Benelli type technique. I'm not a fan of this type of technique as it doesn't provide a significant amount of lift to the breast itself and tends to fail over time. It also tends to flatten out the shape of the breast, and the nipple itself tends to stretch over time. The most common type of technique that I use is the lollipop shaped incision. So that would be a circle around the nipple in order to reposition the nipple into the new higher position that we would like. The purpose of the lift incision is to reshape the breast and put the nipple into a more aesthetically pleasing position. Through the lift incision, we often are able to reshape the breast and remove some of the excess breast tissue. The downside of the lollipop-shaped incision is that it does leave some extra tissue at the base of the incision underneath the breast, which causes a little bit of a lump of the skin. This tends to fade away and calm down over time, usually over the next 6 months to a year. The upside of doing the lollipop-shaped incision is that we're avoiding the bigger anchor-shaped incision. So sometimes people will recommend that you have an incision around the circle of the nipple, straight up and down, as well as underneath in the fold underneath the breast. That's commonly known as an inverted T or anchor-shaped incision. I typically do not do this type of incision unless the breasts are particularly large or particularly droopy. Usually the lollipop-shaped incision can give a great lift and reshape to the breast without all of the associated scarring. Even with the lollipop technique, if we were to have to go back and revise the extra skin underneath the breast, it only requires a small transverse incision instead of the larger anchor-shaped incision. It's important to understand that when we're moving the position of the nipple, we're cutting the nerve and blood supply around the nipple itself, which increases the risk of loss of nipple sensation or potentially even losing the nipple altogether. The risk is very low, but it is something that we have to take into consideration. Obviously, there can be sensory changes not just to the nipple, but to the breast itself. It is very difficult to obtain perfect symmetry, so it is important to understand that the breast will not be perfectly symmetric after surgery, but should be very reasonably close, both visually when you're naked as well as when you're wearing clothing. If you have any further questions about anything that I've said, please feel free to ask me.